Why can Ozempic or Mounjaro feel powerful at 1 month, quieter at 3 months, and uncertain at 6 months? Changing sensations can mislead you about whether treatment is actually working. Both medicines build gradually while your dose, appetite, stomach, and daily routine keep changing. The important signal is not how dramatic each injection feels, but whether measurable results remain healthy and consistent. These drugs strengthen fullness signals between the gut and brain. Ozempic contains semaglutide and works through one hormone signal from the gut. Mounjaro contains tirzepatide and works through two hormone signals. Both can reduce hunger, and food may leave the stomach more slowly. The exact sensations still vary from person to person. Because the dose rises gradually and weekly drug levels build over time, the first month is an adjustment phase, not a final test. The experience can change before the long-term pattern becomes clear. Ask whether hunger is easier to manage, meals are smaller, and side effects remain tolerable. During month 1, those signals may still be uneven. During the first month, the starter dose may reduce appetite within days, yet the response can be uneven. Breakfast may suddenly feel too large, greasy meals may cause nausea, then hunger may return before the next injection, especially near the end of the week. That uneven pattern does not automatically mean failure. The dose is still low, and drug levels may still be changing. Some people notice almost nothing. Others feel strong fullness from a starter dose meant mainly to help the body adjust. Early weekly changes cannot reliably predict the 6-month result. Early scale changes can also mislead. Eating less carbohydrate and salt can reduce stored water, creating a fast initial drop. Constipation can hide fat loss by keeping scale weight higher. Neither change proves how much body fat was actually lost. The first month should answer 3 practical questions. Confirm that protein and fluid intake remain adequate. Check whether nausea or bowel symptoms are manageable. Then assess whether hunger is becoming easier to control, even if the scale moves slowly. After that first month adjustment, many patients reach a steadier dose by month 3. The experience often shifts from obvious stomach effects toward quieter appetite control. Portions remain smaller, food thoughts become less persistent, and stopping after one serving becomes easier. As obvious stomach symptoms fade, some people assume the medicine is becoming weaker. Nausea and heaviness can become less noticeable while appetite remains lower. The treatment may therefore keep helping after the early physical sensations settle. By month 3, predictability becomes useful. You may know which breakfast keeps you comfortable and which dinner causes reflux. You may recognize that skipping lunch leads to evening overeating. Your plan works better when those patterns become visible and repeatable. Predictable appetite control matters more than how strongly the medication feels. One person may feel only mild fullness, yet consistently eat smaller portions. Another may eat almost nothing for 2 days because of severe nausea, then compensate with high-calorie foods and lose weight more slowly overall. Stronger side effects do not prove stronger fat loss. Severe nausea can actually disrupt the routine needed for lasting progress. A patient may feel miserable, move less, lose muscle, and still consume many calories through sweet drinks or soft foods. Liquid calories are especially easy to miss because they require little chewing and may pass comfortably. Sweet coffee, alcohol, juice, and meal replacement drinks can keep total calories high enough to slow weight loss. Small amounts of nuts, cheese, sauces, or desserts can do the same. Food choices are only one reason progress may slow. At 6 months, a smaller body burns fewer calories than before. Hunger may also rise slightly after weight loss. The same eating pattern may therefore create less weight loss than it did earlier. This is why a slower month does not equal a true plateau. Daily weight changes reflect water, bowel contents, salt, and meal timing. A true plateau means average weight has stayed nearly flat across several weeks under consistent conditions. A 6-month slowdown has several possible causes. The body may need fewer calories. Old portions may have returned. Sleep, alcohol, stress, or constipation may distort the trend. Each cause needs a different response. Before changing the dose, compare the last 4 weeks with the previous 4. Check injection timing, hunger, portions, drinks, activity, and bowel patterns. Reviewing several weeks helps show whether the change came from the medicine, food, activity, or bowel habits. Also, ask whether the current dose is actually sustainable. A dose that suppresses eating but causes repeated vomiting is not a successful dose. A lower, tolerable dose may be easier to use consistently than a higher dose that forces interruptions. Once the dose is tolerable, judge its results over time. Look for steady portion control, a falling weight trend, a smaller waist, and better blood sugar when diabetes is present. Strength, energy, hydration, and protein intake also show whether the plan keeps your body working well. Track the same markers consistently instead of relying on memory. Record weekly average weight under similar conditions. Measure the waist once or twice monthly. Note hunger before dinner, episodes of overeating, constipation, vomiting, and missed doses. Those details separate a dose problem from a routine problem. Persistent hunger with consistent use may support discussing a higher dose. Poor intake with ongoing nausea may require slower dose increases or a lower dose. Frequent high-calorie extras require a food adjustment, not automatically more medicine. Weight and hunger are not the only outcomes. Blood sugar may improve before major weight loss appears. Fasting readings can fall because the liver releases less sugar overnight. After-meal readings may improve because the pancreas releases more insulin when blood sugar rises. Insulin lowers blood sugar, and an A1C test estimates average blood sugar over 3 months. People using insulin or blood sugar tablets that increase insulin release, such as glipizide, need extra attention as readings improve. When appetite and blood sugar fall but doses remain unchanged, blood sugar can drop too low. Sweating, shaking, confusion, or unusual weakness should prompt a blood sugar check and a review of diabetes medicines. Beyond blood sugar safety, weight loss quality also matters by month 6. Rapid loss without strength exercise or adequate protein can reduce muscle along with fat. Watch whether stairs, lifting, balance, or usual workouts are becoming harder. A lower number is less valuable when daily strength and movement are clearly declining. Beyond weight loss quality, consistent dosing matters because missed injections can disrupt progress. Hunger may surge after a missed dose, and side effects may return after restarting. The scale may also become erratic. Do not double a dose to compensate. Follow the medication instructions and contact the prescribing team when the schedule becomes confusing. Some symptoms need more than fixing the injection schedule. Contact a clinician promptly for repeated vomiting or inability to keep fluids down. Severe or persistent abdominal pain also needs evaluation. New upper abdominal pain with fever or yellowing skin deserves urgent attention. These warning signs need medical attention, regardless of medication results. For routine follow-up, use a simple month-by-month framework. At 1 month, judge adjustment and how well you tolerate the dose. At 3 months, judge appetite control and repeatable eating patterns. At 6 months, judge weight, waist, blood sugar, strength, and side effects together. The medicine may feel quieter while still working, but those results must confirm that impression. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.